Hi, it's me Harpreet here, having student ID 303608664. I'm going to give a short video presentation for ITECH 3103, which is IT strategy and governments. Moving on to the introduction part first, ICT government involves the formulation, implementation and evaluation of ICT management plan, which further includes the strategies of acquisition, maintenance and decommissioning of ICT systems, including enterprise systems, cloud and mobile environment, giving a brief overview on the given image, whereas IT organization and desirable behavior helps the IT government's arrangements to make the good decisions, good IT decisions, principles, architecture, infrastructure and various applications, which further involves the business performance goals, which helps them to get the better IT metrics and accountabilities. And then going on to the learning journey throughout the course. Lecture and tutorial content helps to understand about the ICT government's framework along with demonstrating legal and ethical issues involved in it. Moreover, it helps to understand the framework of ICT government such as COVID and ITL, how it is used for different organizations to measure their performances for their security issues, etc. And thirdly, the weekly participation during this course helps to understand all the ICT government's related theories time to time, whereas feedback for other students' work also assisted in analyzing the work in a perfect manner to get the good ideas from other people, how to use the different theories involved in it. And then the literature review gives a chance to discuss and contrast the theories in IT management, governments and strategies for different organizations. Thirdly, giving the literature review in the assessment tree, as I used the topic, what is the impact of ICT governments in healthcare sector. The further slides also giving a overview of the findings of the literature review. Basically, IT helps to provide a better treatment decisions, safe and high quality care, provide information on choices and helps to get a better response to the health needs of the communities. And then what is the IT governments? IT governments provides a basic structure for aligning IT strategy along with its business strategy, and by following a formal framework, hospitals can produce measurable results towards achieving their strategies and goals. Commonly used frameworks of ICT governments in health sectors are COVID and ITIL. COVID is a comprehensive framework of globally accepted practices, analytical tools and models, which is used by the organizations to focus on the risk management and mitigation of different various risks involved in it and to make better health related solutions. And whereas ITL is a information technology infrastructure library which focus on IT services management, and it helps to the IT support of processes to support the core processes of the businesses and the healthcare security issues, etc. And then the next slide is about the getting healthcare organization scenario with examples. As IT governments in healthcare used it in different sectors, but getting one of the example as I choose for this presentation is how ICT governments used in community pharmacies, in local pharmacies, how it helps. Basically, pharmacist patient communication is currently limited to infrequent counters in pharmacies, which further limits the delivery and value created by the pharmacy services for their patients, because they have to wait in the queues in the pharmacies to get the assistance from the pharmacist. But the ICT governments really helps in these type of scenarios, whereas ICT can enable value creation by extending pharmacist patient communication beyond these counters. And if we give a brief overview on the design of ICT policies, as it showed, the figure shows the conceptual framework of that how ICT is enabled in community pharmacies. moving on to the first part on left hand side, the strategic intent for extended customer communication helps to make a better initiative services to improve the disease management, to increase the customer loyalty, develop customer insight, and enable planned encounters in the pharmacies, which further generates the good content, governance, and transaction structure for the design requirements for the business models of the hospitals, and we can say the pharmacies. And it drives the ICT enabled implementation of business models, which helps to get the standardized communication, individualized communication, and care and practices, offline and online transitions, communication analysis. And at the end, what outcome we get, that it basically improves the market performance. And then going on to the next slide, which is about the articulation of addressed issues, like how these type of ICT policies help, which issues are addressed by these kind of policies. A tablet PC application enables communication and helps to monitor the patients by the pharmacist easily. And on the other side, the patients also use the smartphone application, which guides them along with the defined interaction template as confirmed by the good pharmacist, and which allows the good communication in between the patient and pharmacist for their medicines and for their care, and how to get the better services from them. On the other side, a mobile backend service helps to synchronize the usage data of the different clients. We can say which kind of data is used by the different patients. And then a BEF interface supports the creation of interaction templates and the analysis of communication by pharmacist or any of the third-party editor. And then the next slide gives the overview of articulation of addressed issues by the pharmacist. It is one of the main screen used by the pharmacist with the help, which helps the ICT governments used by the pharmacist. In this screen, the pharmacist can easily add the new patients, and they can get a view of the different existing patients, like on showing on bottom of the left hand side. There is all of their patients, which from where they can get the information regarding them. And then if we select one of the existing patient, like whose name is Jones, and if we need to know about all his details, and in the first part we can get easily the progress feedback of their treatments, and even they can send the photo feedback of their problems and issues, such as if we take example as shown in the picture of hand, someone get the fracture on their hands, they can easily send them the photo how it's getting better now. And on the other side, the pharmacist can easily give the information, or we can say the feedback, like how the patient is going, as shown in the picture also. And then in the next part, they can give the progress feedback, how the disease is getting better now. And then even they can share the photo feedback, like how it should be now, where the patient can easily compare also, and he feel confident like he's getting better now. And then the last part, they can give the success feedback, as it gives the communication, better communication in between the patients and the pharmacist, getting by sitting in their homes. The patients can easily get the help from the pharmacist. And then the last part, last slide is about the reflection. In the reflection, I can say that I learned about how to analyze an organization business model and ICT government's policies through the lens of policy frameworks, and it helps to know about the ICT government's framework, which includes the COVID framework. Moreover, it helps how to apply an ICT government's framework to generate ICT policies for any of the organization, and it helps to know about the role of ICT governments in diverse settings, which includes global corporate, government, and even not-for-profit sectors as well. It helps to analyze the values, aims, businesses, and operational models of any of the organizations. And then thanks, that's all about for my today's presentation.